Kia ora team, my name's Ben and let's talk crush injuries. So a crush injury is when we have a significant weight on muscle tissue and the severity of which is going to be determined by how heavy the weight is, how long that weight has been applied, and the muscle mass it's been applied to. For crush release syndrome, whereas we get a build-up of all these nasties, and then when we release the crush, they get released into our body. For this to be a problem, it tends to be the equivalent muscle mass of one leg being crushed for more than 60 minutes. All right, let's go back to our anatomy and physiology and have a look at some muscle cells. Here we have our muscle cell, and if you think of a muscle cell, the membrane being like a salty banana. So the banana, we got potassium on the inside and we sprinkle sodium on the top. The way we maintain this is by our sodium potassium pump, so 3 sodium out, 2 potassium in, using ATP as a driving force. The other thing that's important for crush injuries is myoglobin. So myoglobin is like hemoglobin, which transports oxygen through the blood, heme blood, but myo means muscle, so this is transporting oxygen within the muscle. Okay, gorgeous. So now if we have a crush injury, the thing to remember is mahi, because we've got a lot of work to help keep this person safe. So what happens? We get myoglobinuria. So once we've crushed the muscle tissue, the cell membrane is going to get destroyed and we're going to release those myoglobin molecules out into the bloodstream. While the crush is there, then that might be contained, but when we release, all that myoglobin is going to flood into circulation, and then it's going to end up in the kidneys. And what we get is precipitate, which is where if we got concentrated amount of myoglobin, it then forms a solid in the kidney tubules and starts blocking up our kidney tubules, leading to an acute kidney injury. What makes this worse, the more concentrated the myoglobin is, and also if we've got an acidic environment, that's also going to lead to more precipitate or solids being formed in that kidney. M. Then A, acidosis. When we have that crush injury, then we're going to get ischemia, so decreased blood flow beyond the crush. If we've got ischemia, that's going to lead to hypoxia, and if we don't have enough oxygen to our cells, then we can't do that beautiful aerobic metabolism. So we switch to anaerobic metabolism. The problem with this is anaerobic metabolism generates lactic acid, which then breaks apart into lactate and hydrogen. So our acidity skyrockets, which makes our acute kidney injury potentially is going to be worse with that acidity. Also, acidosis is going to decrease cellular function everywhere. We don't like it when our pH changes, and especially like our cardiac tissue. It's not going to be happy. H, hyperkalemia. So again, when that crush injury occurs, some of the cell membranes and muscles are going to get ruptured. So with our salty banana, we got lots of potassium on the inside. The membrane ruptures, that potassium is going to leave the cell. So that's going to make things worse. And the longer we have that ischemia and the longer we have acidosis in that area, the more it's going to cause the sodium potassium pump in our other cells to start to fail. If that pump fails, then now we're going to get potassium leaking out again. So hyperkalemia, too much potassium. This is a problem because our nerves, our heart, rely on the correct balance of electrolytes for muscle contraction and for nerve impulses to run along our wires. So if we've got hyperkalemia, when we release that crush, it can lead to cardiac dysrhythmia or cardiac arrest. And then lastly, we get an inflammatory response. If we have a large crush, if we have any crush, we damage tissue, we get inflammatory response. So when that's released, all those inflammatory markers like cytokines and reactive oxygen species, they get flushed out into our circulation, can lead to pulmonary edema, and if it's systemic, then it can lead to shock. All right. Now, what do we do to try to help this person? IV fluids. If we give them IV fluids, this is going to help to dilute all the toxins. So dilute the amount of myoglobin that gets released, dilute the potassium, dilute the acidity. Sodium bicarbonate, this is alkaline. So when we get all this acidity building up, when the crush has been released, if we've got more alkaline in the body, it's going to help to neutralize that in the blood and the urine. And remember, if our urine's acidic, then we've got more chance of our myoglobin precipitating and forming clumps and blocking up our kidneys. So that's nice. Sodium bicarbonate, alkaline. And calcium chloride, when we get a flush of potassium rushing in, it's going to cause problems with our cell membrane and nerve conduction. So our calcium chloride is going to help to combat that and help stabilize our cell membranes. Then we've got salbutamol. So nebulized salbutamol is going to help to shift potassium into the cells, so to take it out of our blood and store it in the cells. Tourniquet, nice and simple. If you're going to release a crush and we got all these waste products flooding our system, then if we put a tourniquet on, we're going to delay that, so hopefully we can get them to hospital to definitive treatment so they can deal with that. Pain relief, this is going to be a very uncomfortable situation, so definitely pain relief. And things to help with controlled bleeding, for example TXA. Alright team, so this is crush injury. Happy studying!